Okay guys, what are the key messages that we should take home today from today's session? Anybody want to have a go with that? Let's start with you, Bronwyn.
Key messages. I think I'm just going to use the title of my talk. I think you've got to make the most of every opportunity with young people. So if a young people comes to your service, engage them, talk to them, find out what their issues are, and then, go from there. Because they'll come to you with whatever their needs are, and, just engage them, step one, and then work with the services that you have in order to deal with the issues that they're presenting with.
Thanks, Pip. Great question. I think from trying to wear both a clinical hat and a policy hat, there's a whole bunch of people from many organisations here today that work in this field and have been doing so for a while, and that's great. But of course, the challenge is we've got many drug and alcohol services out there that for various reasons really struggle to work with young people. I guess one of the key messages that we're trying to get across is that it's not impossible, and of course there's very important collaborations that you might need to make if you're not doing it already, but to encourage people to do that. We know that there's long gaps currently between people developing drug and alcohol problems and ever accessing treatment, and if we continue to not intervene for many, many years while things are getting worse, we're not going to help people. So that's the message for me.
I think it's really important to take a developmental approach and be holistic. I know our services are often funded to do a specific, to meet a specific KPI, and I guess when we're working with young people, it doesn't always fit neatly into that box. So I think the key elements, I guess, out of today and from travelling as well is making partnerships. So I think on the ground that matters the most. Like if you know somebody in another service that's interested in this space and helping young people as well, kind of working together and promoting kind of partnerships and pathways so needs can be met.
If I had 1 hour, let me tell you exactly what I would have done with all of you. I would have asked you to come up with a list of the 10 most important issues that you would like to resolve. Let's make it 5. Then I would have broken this group into focus groups, because I'm sure you guys don't get together very often. Have a discussion on these specific issues, ask people to pick up the group they want, then come back and give us kind of the output and do it periodically. So this is how you're gonna progress. Because if I may make an observation, again, I work with adolescents, it's my excuse, to be totally open and maybe disinhibited for a while. I'm sure that most of you are tennis, heavy tennis, other players or fans, So you guys have the most gifted tennis player in the world. But something is wrong with his attitude and his behavior. Talk about Nick Kyrgios. He's amazing. When he's at his best, he can kill anybody. So the question is, how do you take the talent and put it together with the discipline and the organization and get to do things together? Because most of your answers will come from the inside, not from the outside. And then after you will reach your conclusion, then you should invite a couple of outsiders to listen to what you have to say, people who are not part of the system and don't need to worry about the future or next check comes from or politics, and they will give you an avid feedback. So this is what I'd like to do, because I see here at least 50 people, there most probably were more of them. But in order to get it all together, I think you need to ask yourself questions and kind of prioritize them and give them back to the system.
So my take on that is for us not to fix Nick Kyrgios, but to think ourselves about where we are at the moment, what our key challenges are, and then to use those, and continue to question, get some feedback, and work on those key priorities for ourselves. Over to you. Questions that you'd like to ask? Nigel.
I'm Nigel Carrington. I'm the manager of the Youth Block Youth Health Service in Redfern. My question is about that many of our services on the ground have long waiting lists, and which we have to report on time and again. And so I'm just wondering what your thoughts are about how we can better manage that situation, think about triaging our clients or shifting them to streams, what ways we can manage to handle those waiting lists and see more young people.
So the question is about triage and streaming?
Yeah, is that a solution to large waiting lists?
And waiting lists. Who's got waiting lists? Shall I pick on Yifrah?
Well, actually, I think that this is something that's
Bronwyn's going to get it next.
more up your alley.
All right, let's go for Bronwyn.
Because what I've learned from visiting Westmead was that, you have the primary or GP professional that see the kids and then screen. And if there's a need to get further in terms of assessment, then those people send them to your group of people with your background, and you do the more organized assessment, and then develop a triage or treatment plan, right? Something along these lines?
I just don't think young people do well with waiting lists. Young people need to be seen now. So we don't have a waiting list, but then I don't have my clinic booked out weeks in advance. I book them out, a couple of weeks, really. But you have to deal with the crisis that they're presenting with at the time. And I suppose because I'm in a hospital setting, that's the way our emergency departments are picked up. And if we see them there and then, we're very fortunate to have mental health CNCs that have a good holistic approach and identify substance use and work collaboratively with us to refer young people. So if we can see them there and then, we will, but if we can't, we'll ring them tomorrow or we'll ring them the next day. And then like the young boy I presented, Noel, who was 13, we saw him as quickly as possible. Every time the fax worker found this kid because he was running away and homeless, she'd ring me and we'd book him in, and then he would run away again. So it's just that continual communication with other organisations. And if it's not one service, you've got to find help for them somewhere else, whether it be mental health or GP or youth health or I just think you can't do waiting lists with young people. It's really tough, isn't it? It's not practical though. I don't know what. Yeah.
So I really applaud the previous Mental Health Minister go out in the injection of funds in the young person space. It's the first significant injection of funds in drug and alcohol in New South Wales in over a decade, 15 years possibly. But of course it's a drop in the ocean. You know that if you work in the field. If we look federally, the federal response to drug and alcohol problems is even more depressing. You'd be aware of the welfare testing, debacle that's being tried to be rolled out at the moment. The problem that we have is that it's such a politicised area of health that is consumed by shock jocks and horrible newspapers as a diversion from the reality of our public life and our situation in Australia all too frequently. And of course Australia does have a fantastic evidence-based model based in epidemiology that tells us what level of services in an ideal world we ought to have for young people and for adults. And it's public knowledge now. It's on public websites. It came out in the parliamentary discussion about the welfare report a couple of weeks ago. I'm sure it's very easy to find. They're the things that our communities need to be lobbying our politicians for, to be able to not have inordinate waiting lists and to try to get closer to the level of services that we need.
Yeah.
Yeah, hi, my name's Chris Davis. I'm a GP with a special interest in helping people with alcohol problem drinking. I'm mainly adults, but I'm seeing a lot more young adults. And I offer a home detox service out of my GP clinic. I've recently detoxed a young lady I'll call Jane. She's been drunk every day from the age of 14. She's now 24. And she's never found a service that could detox her. She comes from a chaotic background. Her mother's a drinker. And she came from Western Sydney to do a home detox through my service, and she's doing really well. But I was sort of surprised that I was the first port of call for her. So I guess that was my first part of the question, is are there any services that will detox our young alcohol-dependent people other than me, I guess? And then when I was trying to plan her recovery and her aftercare, I found that quite difficult too. Headspace weren't really going to be able to offer her long-term ongoing care. The thing which she's found most useful has been a phone app called Daybreak, but even that cost her $60. I managed to get her a free code. But Daybreak is a fantastic service, which is it's online, an online community for young adults and adults, which she's got access to 24/7, and it's peer support. So I guess there's two parts to my question, really.
Okay. So, first one, detox. Who's going to answer that one?
Okay, so for young people, a 24-year-old young adult really should be able to access any adult drug and alcohol service. I don't think there is a age minimum. Well, I don't know. Maybe some adult drug and alcohol services are 18, whereas there is a youth drug and alcohol service out in the PN, I suppose in the paediatric setting as well. But it's about connection and requesting, and identifying if there is substance dependence requiring medicated withdrawal. Regarding inpatient services, I agree it's very difficult for.
She was just very resistant to any sort of inpatient service.
Yeah. So as far as residential services,
do we need it? Young people bounce back, don't they? They don't really need inpatient treatment. Yeah.
Well. There you go, Graham might speak. But as far as residential drug and alcohol services for adolescents, Ted Knopf's is really the place who will take the youngest young people, 13 to 17, and Triple Care Farm also have a withdrawal unit now, which is I think 8 to 10 beds. At Robertson, which is GP supported, and 16 is their youngest age.
But no ambulatory home detox services. That I know of, and I'm more than happy to train GPs in it if they're interested.
No, there are services.
I work in Darlinghurst and East Sydney doctors.
Oh, so we've identified a need for more information about where to go for things. If you Google that, I wonder if you get it. I bet you don't. Let's just go to Natasha then and say, online treatments, Daybreak, Hello Sunday Morning. Is that where we're going?
I guess it's important to know there's a phone number that you can call to find out about more information and services for your local area for that kind of presentation. So that's important to know. I don't know the number off the top of my head.
Go, Elizabeth.
There we go. So I think that's a good start.
Thank you. Sorry, Yifrah.
Again, I'm also looking at the opioid crisis in the United States. One of the biggest problems of society and technology, in some way, it's double-edged sword, is alienation and isolation that lead to homicide, suicide, a lot of the stuff you see happening in the United States every day, fortunately, because of the availability of guns. In CBT protocols, one of the important sessions is social networks. So whether you get naloxone and somebody saved you, it's just the beginning of the road. It's not the end. We need to connect these people with other people, either with similar background and or with interest in what's going on. Because otherwise, it's just a matter of time. The detox is physical, but it's not mental. And they are waiting for this relapse. So I don't know how big AA, NA, or what you mentioned, some kind of virtual or networking, but this is so important to make the connection, the engagement with the next service. That's why continuity of care is so important. Otherwise, it's just it's just a matter of time when she would relapse.
Oh, thank you. Relationships and ongoing care, the key things. Great.
Yeah, hi, Graham Pringle, Western Sydney Local Health District. I run our youth health services in Western Sydney. I guess my question is kind of leading on from some of the other questions, but for those young people at the pointy end, those really marginalised young people, one of the issues that we run across constantly is that if they want to go into any sort of rehabilitation service, they must detox. Detox and hospitals won't take them because they're not dependent. Coming back to Pip's point of they bounce back early. Or there's that waiting list that people were talking about. Young people, particularly those marginalised at-risk young people, if you don't engage them there and then, you may not see them again. And I guess that's my question, is around, with all the funding and that's going around, one of the things that I don't think is being looked at is that instantaneous response, or like we used to have many, many years ago, the old social admission to a hospital.
Social admissions.
So social admissions are very hard unless you're in a rural area to get well, you always need a diagnosis or a reason. Homelessness is it's very hard to get anyone admitted to hospital for being homeless currently. But that's not to say the situation's impossible. And what you're pointing out is something we see every day: the gaps between different sorts of services and different service types. And how do you solve them? The best networking that you can have between service managers and directors, and relationships between different services, and that's a lot of work to do. There is, and on both perspectives, there's errors at the moment. So, there's times where people are being asked to detox when they don't really need to detox, and there's times when people do really need to detox and they can't access a detox in the appropriate time. One of the good things that's happening, at least in Central and I think in Western Sydney, is another model of care of more intensive outpatient work, and that might help this sort of group connect with services when they don't attend an appointment at 9 o'clock in the morning, or call on the waiting list time when the phone's ready, or those sorts of things. And that's more resources to try to help people connect with treatment. That might help this sort of situation. That's my suggestion.
And I'm standing on this side, but my right eyeball's been neglecting this side, I'm sorry. Any questions from this side? No? Last one at the back then. There.
Hi, my name's John Dean. I'm Schooling District Clinical Leader based in Wagga Wagga. A lot of the discussion's been far, I guess, from our experience in more rural and remote settings, and I noticed in one of Natasha's slides she did mention rural and remote, and I was just wondering what experience you had in your trip that might inform how we respond to these issues in quite remote communities.
What's exciting about rural and remote? How are we going to tackle that?
I think it is a really big challenge. I'm from Hunter New England Health District, and part of my role goes up to Moree, so I'm very aware of some of the challenges in some of the rural and remote communities. When talking with the services internationally, a lot of the places that I went to were city-based, and outside of the city there was still the issues that we face in the lack of services. And I think we know that telehealth is gaining a lot of momentum, and there's a lot of research coming out about telehealth now, but it's not the only answer either. So I don't know that I have all of the answers, but I do think it's something that we need to really focus on, because we know, like in looking at the data, the substance use in young people is higher for those areas, but doesn't necessarily get the focus. So I don't know if anyone else has any other comments. I think it's really, really hard.
Comments? Anybody who's been to a BNS ball will know that, yes, there are some significant drug and alcohol problems in the bush. All right. Would you please join with me in thanking our panel?